Doc on the Run. We help injured runners run.
All right, so backing up a little bit. Now, if you're going to figure out how to fix your Achilles tendon, you have to understand what it feels like when it starts. So we're going to talk about the symptoms. Now, at first, it may just feel tight. The Achilles may feel like it's getting squeezed, and in the later stages, when runners finally start admitting it's a problem, it hurts about 1 or 2 inches above the heel bone. If you squeeze this spot and it's tender, you may notice it's also swollen. Often, it is only swollen right in that area where you feel the tenderness. Part of the challenge is to make sure that you don't make a misdiagnosis or that your doctor doesn't make a misdiagnosis with some similar condition. And there are some pains that are misdiagnosed, and you have to understand how to tell the difference. So we're going to diverge from our main topic here for just a minute to make sure you don't have a different condition masquerading as Achilles tendonitis. The first condition is called flexor hallucis longus tenosynovitis, and that's a long name, and we can just talk about the FHL tendon for short, but that can cause pain in the back of the ankle deep to the Achilles tendon. And the FHL tendon is a muscle that's deep to the calf muscle, but then the tendon goes way in the back of your leg, the deepest part of the back of your leg, behind the Achilles tendon, runs down around the back of the ankle, and it goes all the way out to the big toe, and that one helps you pull down with your big toe. So if you put your foot on the ground and you press your big toe into the ground, it's that FHL tendon that's pulling the toe down against the ground. Now, I have helped lots of patients through Skype consultations or virtual doctor visits who thought they had Achilles tendonitis, but when we have them check the Achilles tendon, it doesn't hurt. The pain and tenderness is actually way deep to the Achilles, but we can rule that out just by comparing the tenderness or absence of tenderness when we palpate or push on each of those specific tendons, and there's an easy way to do that. And if you have tenderness on the FHL tendon but not the Achilles tendon, then you're not going to get better if you do Achilles tendon treatment, so you have to rule that out. Retrocalcaneal bursitis is another condition that more often afflicts runners and might be confused with Achilles tendonitis. Now, I've seen lots of patients who called me and said they had Achilles tendonitis, but when I walk them through the process of self-diagnosis, whether that's on the phone or on Skype, the Achilles tendon doesn't really hurt. All the pain is on the back of the heel bone, near where the Achilles tendon hurts, but it's actually an inflamed fluid-filled sac called a bursa that's causing the trouble. That's a completely different issue. So again, if you treat this like Achilles tendonitis, you're not going to get better because you're treating the wrong problem. Again, it's really important to rule these two things out simply because these conditions won't respond to the treatments that most often help the Achilles tendon heal. I mean, think about it. Wouldn't you agree that it's important to rule out conditions that won't get better if you treat it like Achilles tendonitis? You know, you're on a timeline. You have to get better. You have to get back to running. You have to understand which symptoms really look like Achilles tendonitis. So let's talk about those. You're more likely to have Achilles tendonitis or Achilles tendinosis if you have any of the following symptoms. And the first thing is pain. If you have an ache, stiffness, soreness, or tenderness in the Achilles tendon anywhere between the heel bone and the calf muscle at the back of the leg, in its early stages, you may only notice this pain when you run. Or it is possible that you notice some soreness in the back of the leg when you get out of bed early in the morning. Many people, of course, particularly runners who have a high pain threshold, will ignore this pain because the soreness seems to disappear as the day goes on once they start walking, once they loosen up. However, runners will also often notice that this pain hurts more and the soreness returns in the middle of their long runs and speed workouts. Now, the other thing that's consistent with Achilles tendon problems is Achilles tenderness. So if you press anywhere along the course of the tendon, you have anything ranging from mild tenderness to intense pain when you push on it or squeeze it, this should be concerning. You should never have any pain or tenderness when you press along the Achilles tendon anywhere. If you notice tenderness in the Achilles tendon, you should see a sports medicine foot and ankle specialist immediately. You've got to do something to treat it. So if you don't go see a doctor, you need to at least try some self-treatments right away to see if you can get that to improve. The third thing is any kind of deformity in the Achilles tendon. Now, an abnormal appearance of the tendon should be a concern. The Achilles tendon is normally firm and it's perfectly smooth. Now, of course, you can compare this to the other side. If you feel any lump, bump, knot, nodule, anything that feels like a marble inside the tendon, anywhere along the tendon, this is not normal. Achilles tendinosis is the common reason for these types of abnormal changes in the way the tendon feels. However, there are other problems that can cause these deformities, such as a ganglion cyst or other tendon tumors, but those things are really, really rare by comparison.
Doc on the Run. We help injured runners run.